Welcome, everybody, to Our World, Our Power podcast. If the background looks a little bit different, it's because I'm in my home studio as opposed to the radio station. So, hi, Glenn. How are you?
I'm great. I'm great.
Hi, Jen. How are you doing? Uh,
Hi, good to
and
talk
let
to
me
you.
just let everybody know Jen is from the Jamaica bid here in Queens,
Jamaica sent the
and
bid.
Glenn is from the Southern bid here in Jamaica, Queens as well. So today it looks like Glenn is my guest on the show as well. How are you guys doing, first of all?
Go ahead, Jen.
We are incredibly busy just trying to keep up with the fire hose of information for businesses that's coming down from the federal, state, and city levels. But we're thankful for our community, both in Jamaica and with our economic development professionals, just that we can lean on each other right now to share the information that we need.
Okay. Also, Glenn, what's happening on Southern Boulevard with the stores that are open, or are they open? Because I haven't been over there.
The stores have been open. Both fish markets have been doing lots of business. Ideal supermarket has been pretty much fully stocked this whole time. So they seem to be doing, quite a bit of business. The eateries um, seem to be doing relatively well. There's a lot of hustle and bustle, on Archer and Sutphin. So I mean that is still a hub of uh, bus services and what have you. So there's still a lot of commotion, a lot of people in that vicinity. So it almost looks like normal.
Okay.
It's that busy, but I'm sure when we go into the Sunday night 8 p.m. No non-essential businesses operating. I think things will slow down a bit after that.
Jennifer, did you hear that there are no fares being allowed? You get on the bus and train for free.
I no, I didn't hear that. I mean, that's something I wasn't aware of.
Okay. Glenn, did you hear that?
I did hear that, and I think it's in the spirit of um, allowing people to at least move around, who have to move around, because again, we've talking about essentials. So if you're essential, you're probably traveling to the hospital. If you're a home care aide, you're going to a client, or you're getting food or what have you. So it sort of makes sense. I know it's not going to be the regular service. I believe it's going to be like a Sunday service. They were saying,
Okay.
somewhat limited. So I don't think it's going to be the full service, but I think it is going to be limited to allow people to get back and forth.
Well, since both of you control Jamaica Queens, the Jamaica bid and the Southern bid, can you tell me what's the advantages that the consumers have, and what they should be aware of, and what they should purchase before things run out? Have you heard anything like that from the different stores, or have you observed it physically?
Well, go ahead, Jen.
Oh,
There's a lot of information. Go ahead, Jen. You go
yeah.
first.
Well, I was just going to say, they should be aware of those restaurants that offer delivery and takeout service. And our bid has put together a spreadsheet. We have 29 restaurants as of Friday that were offering this. So if you go to our website, Jamaica.nyc, you can see categories, whether they do it by takeout or by delivery. And if so, we even listed out if it's Seamless, Grubhub, restaurants, own staff delivering, just in case you end up really having to be homebound. You should also be aware of some of the stores that are selling essential items and know that those will stay open, like your corner store, the pharmacy, the bodega. And our staff right now is compiling which of those provide delivery services as well. So we'll have that information up on our website soon.
Okay, Glenn.
Well, we don't have the plethora of businesses that Jamaica Center Bid does that are still open. We've got a few essentials that are open. The Nutripan 2 and Beijing Dumpling House, and of course Starbucks is doing takeout order, no seating and gathering. We've got a couple of other Golden Crust, and we've got the fish market that's actually steaming and frying fish on 91st. And then we've got a couple of the dollar stores that are open, that are still selling water and some of the essential items. But we don't have a whole lot going on. We've got the pizza shops and the chicken fry places are still open around Sutphin and Archer. So the cluster of things, and of course we've got the Dunkin' Donuts underneath the trestle. So we've got those stores that are still open, and will probably remain open after the, I guess I'll call it a curfew, or it's not actually a curfew, but stay in place, which I actually understand why the governor didn't like shelter in place, because it implied active shooting rather than a stay in your home type of situation. So I get the wording that he was wanted to use rather than shelter in place. But that's what's happening on Sutphin.
Okay. Also, I wanted to find out from both of you, what about the hospitals, and have you heard anything as far as, emergencies? Because I've been also saying that if you're sick, stay home, don't go to the hospital. Or, so I was just wondering, do people have that information out there?
I mean, I just read an article today in the New York Times that was listing out some of the different hospitals that are already starting to reach capacity as far as critical care or emergency care. I think one of the hospitals was in Elmsford, if we're talking about Queens locations.
Right, Elmhurst. Yeah.
Elmhurst. So yeah, I think New York Times has been covering that pretty extensively. I don't know, Glenn, have you heard anything?
I haven't heard a whole lot, but I know that the hospital facilities and even the clinics. I know Joseph P. Adabo Family Health Center was looking to set up a tent testing area, but wasn't able to complete that. That was going to be out in Far Rockaway. Jamaica Hospital, I'm sure, is Jamaica Hospital and Queens, the old Queens General, are probably a little taxed, I'm sure. And again, that's why we're being asked to stay in place. And unless you have symptoms, to stay home and just wait out the 14 days quarantine. So it's I haven't heard anything specific, but I know that that's the issue that we're trying to prevent, the as they call it, the big curve.
Okay. Are you all prepared in case this gets worse than it is? Have you spoken, either one of you, have you spoken to the city council or the assembly as to other actions that might be taking place within the community?
Well, a message went out from the city to all of the business improvement districts asking them to fill out a survey. I believe it was from the Office of Emergency Management, identifying spaces that could serve as sort of centers where teams of city employees or state, federal, or emergency service employees could set up stations to assist people. So they were asking for advice on spots, like plazas or parks or buildings that could accommodate emergency services if need be. So I think that's something a lot of organizations like ours we're trying to inventory and send that information back to the city right away so that they know about that.
Oh, that's very good.
And then I think this is something where we just have to be nimble. This doesn't happen all the time. So we're rapidly trying to speak with one another and figure out what our next move is. And the Office of Emergency Management has weekly calls on Wednesdays with a group of us. It's called the Public-Private Partnership, where they're sharing information with us and we're able to ask questions. In Queens, all of us Queens bids, plus other economic development organizations, the Queens Chamber, Queens Economic Development Corporation, Greater Jamaica Development Corporation, we're having almost daily phone calls to talk about these issues as well, so that we can create unified action steps as needed to respond, which I think is really great. I have to say the joint communication and collaboration has been amazing.
That's good. That's wonderful. Glenn, I know you're on different boards within the community. Can you tell me, have you heard anything as far as where they might be setting up for testing, or because a lot of the testing is either up in New Rochelle, some is in New Jersey, but I haven't heard anything really specifically as far as Queens and South Jamaica, Queens. Where would people go?
There's still a lot of indecision, just because this is, as Jennifer said, this is just so new, and we've never had to organize ourselves this way. This is a kind of a paradigm shift in terms of how we do business, how we interact with business, and because of that, there's some growing pains around that. SBS is coordinating, Small Business Services is coordinating some activity around loans and employee extension programs, grants, and continued business. There are going to be some other agencies that are going to be looking to support small businesses. I understand the SBA, Small Business Administration, is going to be providing some information as well. But as far as I know that the only one that I'd heard of in terms of you're talking about drive-through testing sites.
Yes.
I think the problem again is that you've got to have the equipment to keep the staff safe, and you've got to have enough of that on hand, and you don't want to now put that at stake, and now the actual physical facilities don't have what they need. And unfortunately, I hate to say this, but I've been hearing it more than one place, is that people are coming into these health facilities and stealing toilet paper and hand sanitizer and masks. So that's another aspect of these hospital healthcare people taking care of themselves. So we've got some.
We don't really have enough supplies. We don't have enough masks.
We don't have testing. We don't have the mask. And if we don't get ahead of this curve, we're not going to have enough beds with ventilators and ICU beds to support the people who are really in a bad way. So again, that's why we're being asked to stay at home, to minimize gatherings, and we, as the bids, Jennifer, myself, and Derek, are going to be looking to see how the downtown bids can support the businesses that are still in place in terms of what they need for at least short-term financing. There's a lot of things in play, and as Jennifer said earlier, we're looking to stay in touch so that we can keep sending out the information and communication, because quite frankly, it's changing. and we're going to start this new stay at home Sunday night, and we're going to see how it goes. I mean, the first couple of days may be great, but what happens after people start running out of stuff and have to go to the pharmacy, have to go to the supermarket, and we still don't know, what's going to be, available on the shelves. So I mean, there's a lot of variables that are not necessarily, we're not sure about what it's going to be. But I think, we're trying to make sure that businesses and individuals as well, because the information that we have on our websites are not just for businesses, they're for individuals as well. And there are some organizations that are looking to help the individuals.
Now we have a lot of shelters here in Queens, and we also have a lot of people that are homeless. What about the food supply as to how are they managing? Has any of the shelters reached out to you all?
I feel like it'd be irresponsible for me to even get into that entire realm. That is not my professional area of expertise. So, I would recommend maybe speaking to them directly. We have fielded a lot of calls from businesses, especially in the past 4 days.
Okay.
Before that, we were, it's so weird how different it was even 10 days ago, because it was still okay to go out and talk to people. You just kept your distance. And we went to, I want to say, about 15 to 20 businesses, and we tried to sort it out by different types of businesses. And this was when there was definitely a cluster in Westchester County, but there was just 1 to 2 cases in New York City. And at the time, businesses said, oh, we're not really feeling the pinch yet. And then this wave just happened, and people stopped going to businesses. And then the varying degrees of employee restrictions started to happen. And if employees got sick, they needed to stay home. There's all of these human resource issues, that you have to put into play. And that's when our phone really started ringing a lot. And so we've been busy just helping these small businesses decipher things like, am I an essential business? I sell some essential supplies, but not all of them. And who can I reach out to find out for sure? That's been a question we've gotten. Other businesses have asked questions about safe ways to close up their business. And some other businesses have called about the grants and the way their finances are structured, would that benefit them? So what we've been trying.
Is that those grants on hold now because of everything that's going on, or is it still in?
No, I'm talking about the new grant, the one that was released by the city, the employee retention grant.
Okay.
Released by the city of New York. And if people are interested in learning more about that grant, they can go to New York City's Department of Small Business Services, nyc.gov/SBS. That's for small businesses, 1 to 4 employees who need support to help make payroll. And then there's 0 interest loans that the city are offering. And then, as Glenn said, the federal Small Business Administration loan for working capital for small businesses, that application just went live, I think it was 2 days ago. So we've been getting some calls about those grants and loans, and trying to direct people to those appropriate sites where they can learn more and apply.
Oh,
Yeah, and these are all new, specifically for the coronavirus. So these are things to impact and assist the businesses to keep them up and running, because as you know, the small businesses are 50% of the employment in this country, and so it's important that they don't fail, and they've got some some opportunities. One of the other things that still is not hasn't been addressed is what are people going to do when they're behind in their rents? So that's something that's still being looked at to see how we can support them. I know that Con Ed and the National Grid have said that they won't shut off anybody for non-payment at this point in time.
Yes, I did hear that too. Yes.
But again, this is at this point in time. So, we'll have to relook at that six weeks out, 2 months out, and see where they are. Because I know, for example, the diocese, the Episcopal diocese in Queens here, has said that they're not going to have any religious services till May 17th, which of course is after Easter and what have you, which is a huge event for them not to be participating in. So with things are in flux. Things may change after in the next 3 or 4 days. So we just have to be vigilant and be able to supply whatever the newest information is in terms of where to go, what's available, and keeping these businesses afloat.
Yeah, and along that line, I'd like to pitch something that we put on our website. We're just monitoring the news and all of these resources daily. And so if you go to jamaica.nyc, we just put up a new COVID-19 special page, and we tried to make it easy for businesses. We categorize everything. So we have a section, financial support for businesses. That's where we list all the loans, grants, capital raising platforms. We have a section if businesses do have to close, do have to lay off employees, with the frequent links that they may want, like to the New York State Department of Labor. We even found some, information about companies located in Queens that some of these businesses can reach out to if they need to clean and sanitize their workspace. So
that's wonderful.
Yeah. So I would ask, one of the problems we've come across in our work is it's been pretty easy to get a hold of businesses that are dialed in digitally. So if they're frequent users of social media, email, they're very responsive to us, but we've been struggling getting to some of those businesses that don't like to use the computer. And so, we've gone to different businesses. We're doing a snail mail that's going out to them. But I would implore your listeners that if there's a business they love in Jamaica and they want to make sure that business knows what's happening and is tuned in, to please visit our page. Maybe Glenn has a page like that too, where they can access all of those links to important business information, or call me, call Glenn, call Derek. We're here to help and direct them. And our main phone numbers are listed on our website. And so if they don't feel comfortable with a computer, that's okay. We're human beings. We're here to help them, and we can walk them through the process over the phone.
Glenn, how can people reach you if they need to?
They can give me a call at 718-291-2110. That's the office number, but I've got it's runs straight to my cell phone, so I'll get that wherever I am. And our website is www.sutphin, SUTPHIN, BLVD, bid.org. So that's our website, and check it out. We've got some information up there as well.
Okay. I thank you, both of you, for being on Our World, Our Power radio show. And hopefully next week or the next few weeks, I will be back in the studio. But from now on, listeners, I will be broadcasting from my home office. So if you need to reach me, you can also reach me at 646-340-7271. And of course, remember ourworldmedia.com. And you can also get a hold of me through Facebook and Instagram. I thank you all for sharing this time with me. And as you know, we are Our World, where your news reflects you and your community. Thank you all for listening. Thank you, guys.